So even among those who qualify for the first phase of the vaccine, like healthcare workers, there's some confusion out there. So especially healthcare workers who aren't serving in hospitals or long-term care facilities like dentists. And it's different between each county in Iowa. Local 5's Eva Anderson looks into where dental providers fall in line.
Dr. Austin Foster, an orthodontist, and Dr. Devin Padel, a surgery resident, are both in the first wave of vaccine distribution.
I was very excited. I think everybody that stands in line and waits for their turn is very excited to get the vaccine.
But even though they're both healthcare professionals in Polk County, one has a vaccine and the other is still waiting.
So in Polk County, we've been told that we will probably be some of the last ones in the state of Iowa as dentists to get the vaccine.
The couple, recently engaged, says it's often a topic of discussion. Dr. Padel operates on known COVID-positive patients, but worries her fiance might treat a patient who's unaware they have it.
And for me, it was easy. I mean, it showed up at our hospital. I was told to come here at a specific date and time, and it's really unfortunate that his whole staff is right in the mouth of his patients, being exposed every day to somebody that may be positive.
So where are dental providers supposed to fall in line? The CDC leaves it up to each state, but recommends healthcare personnel be, quote, among those offered the first doses. The CDC includes dentists as well as hygienists and assistants. But here's where it gets tricky. Even within Iowa, the rollout varies from county to county.
Because in Polk County, getting through phase one will take longer because we have 200 assisted living type facilities and then multiple large hospitals.
Like the one Dr. Padel works at. Monday, Polk County Health announced that dentists there could start receiving the vaccine next week. But over in Warren County,
okay, excited to be getting the COVID-19 vaccine today.
Dr. Tyler Villiard at Des Moines River Dental Care and his staff got vaccinated early last week.
That's it.
Yeah.
Thank you.
Warren County had enough doses of the Moderna vaccine for him and his staff. Dr. Villiard saying they all play an important role in the pandemic.
I would not call myself a frontline worker by any means, but I think the idea was we wanted to keep seeing emergency patients to help lessen the burden on our hospitals.
As for Dr. Foster, he says he understands it can't happen all at once, and he knows he's not in a risky demographic. But he hopes it happens sooner rather than later to protect his whole team.
Obviously, I want the vaccine, right? But I really want to make sure that my staff are taken care of as quickly as they can be.
In Des Moines, Eva Anderson, Local 5 News, We Are Iowa.
And the Iowa Department of Public Health confirmed that dental providers are considered phase 1A, and that means the first part of the first phase. They said it's up to each county to prioritize how they distribute it. Adding, quote, adjustments can be made by IDPH each week to increase or reduce allocations based on the inventory remaining in the county. Now, this means counties do not receive the same number of vaccines as other counties, and the allocation will fluctuate each week to adjust for vaccine inventory.